As a trustee, principal officer, and retirement fund consultant, you need to keep up to date with what is happening in the industry. EBnet empowers our subscribers with the latest news, trends, and developments in the retirement industry, thus allowing them to deliver their best to the fund members they serve. At EBnet, we continually source and showcase new technology solutions to the retirement fund industry. This way we assist the industry to evolve and improve the outcomes for retirement fund members. Our unique 3D, virtual expo and conference, is a typical example of us adapting to change and adopting new technologies. Gamification methodologies help to make our conference a unique user experience whilst delivering value to our exhibitors. We provide the ideal digital platform, bringing a wide scope of research done by several experts in the industry to the attention of all stakeholders. This way, we help raise standards and best practices, and so improve the retirement journey of those we all serve. As a digital news and knowledge portal, we have the widest and most far-reaching online footprint in the retirement industry and connect with over 95% of funds and consultants in the employee benefits space. EBnet also powers Pensions World Essay, a quarterly digital and print industry journal that has become the magazine of choice of thousands of readers in the retirement industry. We welcome you on this journey with us. Let's together shape the retirement industry for the future.
All right, good morning, everybody. Are we live? A very good morning and welcome to the EBnet 6th year of conference. And we are in the last session today, albeit that the EBnet conference has in fact been open for 2 full days already. And we have had an astonishing number of people go through the conference, which is extraordinarily pleasing to myself. Those who don't know who I am David Wheel. I'm CEO of the ICTS group, and EBnet is one of the companies that fall inside the ICTS group. This is our 2nd virtual conference, and wow, what fun. Utilizing gamification, attend at your own convenience. I think that we have made great strides as a business in making a conference such as this absolute fun. And I myself have unbelievably enjoyed the utilization of the tools that Chris and his team have made available to us at this conference. As far as I'm concerned, I don't think we'll ever go back to the way we did conferencing in the past because this is far too much fun. We have, of course, linked to our gamification. We've got wonderful prizes that have been made available to us by our sponsors, of which I need to give a big thank you to. We have a lovely TV set, a beautiful iPad, and a lovely laptop that's available for the top people who make the most points in terms of the gamification, visiting stands, and utilizing the conference facilities to its fullest. And to those, I need to thank Momentum, Sanlam Trust, Discovery, Alexander Forbes, and Plus 1X. Obviously, those of you who are involved in the industry yourself and require CPD points are available to all those who want, and there are lots of different ways of getting them. Most importantly, you can get them through Pensions World, and for those of you who have not seen it, we launched the 4th quarter Pensions World today or yesterday, and it's live, so you can go on to the EBnet site and you can see the latest Pensions World, or you can pick it up with Pensions World South Africa. Just, I suppose, having a conference like this, it wouldn't be right not to give you a little bit of an update as to how EBnet has done as a business over the last year. It's obviously been an extremely difficult year for many, And I'm pleased to say that things have started to pick up quite smartly in the business world. And EBnet has, in fact, had a very good year, and we made great strides in terms of our viewership and listenership and readership across both the portal, the information portal, and Pensions World South Africa. So thank you to all of you who've, one, attended the conference, and two, who have supported EBnet and Pensions World over the last year. We've also got the trustee tutors, which are a great way to learn for trustees, for practitioners, and a wonderful way to earn CPD points for all of you that need them. We have two excellent speakers this morning, and we have, I suppose, no conference could go without some kind of insight into COVID and what we've been through over the last 18 months to 2 years. And we have our first speaker, who's an absolute expert from Discovery, and he is Dr. Ryan Noach. I'll give you a little bit of an introduction about him. Many of you will be familiar with him. Strangely enough, I was doing some browsing through the social media myself and picked up a wonderful talk by Ryan Noach, and I listened to it, and I thought, wow, what a great talk, what wonderful insights from somebody. And I thought, this is somebody who we've got to have at our conference. And Ryan is himself not only chief executive of Discovery Health, and has spent time in the bank at Discovery and held leadership positions across the Netcare group. But his research into COVID and the pandemic, I think he's going to share with us some of those results from what they've done, some of the issues such as efficacy of vaccinations, the impact of long COVID, and they have some wonderful research to share with us. I think without any further ado, I'm not going to steal any more of Ryan's thunder, and I'm going to let Ryan get on with the opening talk of this morning. And our second speaker this morning is also something to look forward to, and that is somebody who's also well known in the speaking arena, and that is Mark Sham, and I will share a little bit more about him after we've finished listening to Ryan. So without any further ado, I'm going to hand over to you, Ryan, and enjoy the talk, everybody. Thank you.
Thanks very much, David, and really fabulous to be with you all this morning. Appreciate the invitation, David, from you and Chris, and great to extend our partnership and relationship with EBnet and participate in your conference. I'm thrilled to be sharing some information with you about COVID-19 today. For those of you that have followed webinars or talks that I've done in the past, I will take a similar format and approach, but update you on the metrics and numbers. I'm going to work quite swiftly through it. I have a fairly large number of slides, and hopefully share with you some really interesting information that you'll enjoy around some of the vaccine efficacy and safety data that we're seeing in our own data, and also looking forward some of the implications to employer groups about what the world looks like living with COVID going forward. Right, so getting straight into it, a little bit about the progression of the pandemic, where we are, and are we going to face a fourth wave, and what does that look like, and just sharing some thoughts and views around that. Progress of vaccination in our country, and the journey that we've been on in mandating vaccination for our employees at Discovery Health, and really some of the issues that go with vaccine mandates, which may be of interest to those of you that are employers as well. As I said earlier, some data around vaccine safety and efficacy, and importantly, some of the longer term impacts of COVID. So moving straight on to progression of the pandemic. I know that you're hearing the national numbers regularly on national media, but just to share with you in yellow at the top of that chart, let me enable my laser pointer there. In yellow at the top of that chart, the metrics that we're seeing across Discovery Health, just to give a sense of what we've seen in our member base. Without going into all of them, to say that we've done almost 2.5 million COVID-19 tests, of which about 435,000 Discovery Health members have tested positive, which represents about 12% of our member base. We think that's much lower than the prevalence of disease in the population. Our estimates are that about 70% of South Africa has been infected at some point in time. Remember, this is positive test results only, and because many infections of COVID-19 are asymptomatic, many people choose not to go for a test or don't even know that they're sick, and so the real prevalence is definitely much higher. Important to point out that there have been over 11,000 repeat cases. These are cases where somebody has tested positive for COVID-19 more than once. And we're seeing cases now of people testing positive 3 times and even a small number that have tested positive 4 times. This is very important because in the world of COVID-19, it demonstrates that the immunity is not necessarily durable from a natural infection. In other words, once you've developed natural immunity following an infection with COVID-19, it does not necessarily give you lasting protection. We're seeing that it gives good protection for the first 3 months or so after that infection, but then that wanes very, very quickly. And we'll talk a little bit more about that in the context of vaccines later on. This is translated from those 435,000 infections into 60,000 members that have required admission to hospital. Quite astounding. This time, 18 months ago, we didn't know about COVID-19. It wasn't causing a single admission to hospital. It was not something we priced for in medical scheme risk pools or understood as healthcare practitioners. As I sit with you today, more than 60,000 patients treated in hospital. That represents about 14% of the total positive PCR tests or COVID tests. We're seeing that to be quite a consistent percentage that seems pretty stable over time. It's important to say that almost 10% of those people land up being readmitted to hospital for some reason or another. And something that we're seeing clearly in COVID-19 is that it unmasks underlying disease. I'll show you in a later chart what we're seeing around that. So of all the people admitted to hospital, almost 10% land up requiring a second admission after their COVID-19 admission. Tragically, and we are living through truly tragic periods, this is translated into a case fatality rate of almost 3.5%. So of the positive tests recorded, nearly 3.5% of those unfortunately land up dying. And this is an absolutely devastating period that we live through. We've lost 14,200 customers. And through this period, in fact, have lost 24 staff members as well. So it's something that's affected many of us. I'm sure all of us on this call know of somebody that has unfortunately demised as a result of COVID-19. About 20% of the people that are admitted to hospital, so of all admissions to hospital, about 20% unfortunately don't land up getting discharged. That's an inordinately high mortality rate for hospital admissions. 1 in 5 people admitted to hospital for COVID-19 are not discharged in the Discovery Health experience. We'll talk a lot more about vaccines down the line. I'm going to go quite quickly now just to say that in thinking about a wave of COVID, we take into account the underlying population immunity, the amount of physical contact, and the resilience of that population to determine how severe that wave will be. And the key issue here is the underlying immunity. In the context of vaccines, the most important tool that we have as a population to mitigate COVID infection is vaccination. And by pushing up the proportion of the population that's immunized, we do mitigate the chances of a wave of COVID-19 with severe complications quite meaningfully. Of course, our personal behavior is critical, and that is another mitigant that we need to be highly aware of. Social distancing, staying out of mass gatherings, staying in outdoor, well-ventilated areas, hygiene precautions. These are all critical behaviors. Mask wearing has been demonstrated in evidence from a behavioral point of view to protect us from COVID-19. So, we do have tools to mitigate wave formation, and we should be deploying them across the population. So as we compare the three waves of COVID-19 that we've been through at the moment, you can look on the top chart by infections, the middle chart by admissions to hospital, and the lowest chart by deaths. And I think what's pretty reassuring now to start off with is to say that the infection rate has come all the way down now to an attack rate of 1.3. An attack rate is the number of infections per 100,000 people in the population per day. Let me say that slowly. The number of infections per 100,000 people in the population per day. And that attack rate is down to 1.3 now. The World Health Organization really determined a threshold of 5 at which there should be concern at population level about the emergence of a wave. And so we are without doubt out of the third wave now, and not currently likely to be heading into a new wave imminently, although I will show you the projection for the new wave on the next couple of slides. But as the attack rate stands now, it feels like the epidemic is well under control. What's interesting about the infections in the third wave is you can see the shape of this curve is very broad and bimodal. It's got two peaks. And that's quite different to the shape of the previous curves. The second wave was by far our worst wave. Steep incline, rapidly affecting the entire country right across the board, largely because there was extensive mobility during December 2020. And so infections were seeded in all the provinces simultaneously with this very high peak and then a precipitous drop. This wave 3 rolled out slowly across the different regions of the country, protected by some of the travel restrictions and lockdown restrictions. And as a result, this wave 3 ended up looking quite different. But the space under the curve, if you look at the number of infections in total, was the greatest, in fact, in the third wave. That's not true for admissions. While the number of admissions per day peaked at the same level as the wave 2 level, actually, I'll show you on a later slide that the proportion of people that were admitted, the percentage of people that required admission after an infection was lower. Now, wave 3 was characterized by this Delta variant. And what we've learned about the Delta variant, as this chart shows, it's highly contagious. So there were more infections. It's not necessarily as virulent, and so there were slightly less admissions as a proportion of infections. As a result of this lower virulence, deaths in wave 3, again as a proportion of infections, were lower than in wave 2. If you count the absolute number of deaths, it was equal to wave 2 and just above potentially, but as a proportion of total people infected, it was lower related to the lower virulence of the disease. As we all know, the people that are likely to unfortunately experience severe complications and die are those that are older and those that live with a higher number of chronic illnesses, as you see on the left and right of this chart respectively. It's important that we show you in our data that people over the age of 70 have about a 50% chance of requiring admission to hospital if they develop COVID-19. That's quite meaningful. 1 out of 2 people over the age of 70 who contracts COVID-19 lands up in hospital. 1 out of 3 over the age of 60 lands up in hospital. So older age is a meaningful risk factor in our data. You know this, but I wanted to share with you data for people like you and I living here in South Africa who are members of Discovery Health Medical Scheme. Also, depending on the number of chronic conditions, you're more likely to be admitted. People living with 5 or more chronic conditions, 1 in 2 of them, 50% chance of admission to hospital. So these are the major risk factors. What's misleading about this is that there's misinformation about the risks of COVID-19 for younger people. You know, people know that elderly and those living with chronic illness are more at risk. They underestimate the risks for younger people. And so I wanted to share with you this very interesting data. If you look at wave 3's data, about 60% of the people admitted to hospital during wave 3 that were Discovery Health Medical Scheme members were between the ages of 18 and 49. You can see 33% between 35 and 49 and 25% between 18 and 34. Now, what's important about this is for me to leave you a message that you are not immune to the severe complications of COVID-19 if you're young and fit. That does not confer immunity. Your risk of severe complications is certainly lower than older, unhealthier people. but you are not immune. And in fact, young, healthy people between 18 and 49 represent the majority of hospital admissions across our base. Of course, there are many more young, healthy people that are our members, notwithstanding which 60% of the admissions is in these age groups. And so an important message for you to understand and take to your constituencies. Very quickly, as I said before, in the Delta wave, the third wave, we did see on a risk-adjusted basis a lower proportion of admissions than in wave 1 and wave 2. In other words, your chances of being admitted to hospital after a Delta infection during wave 3 in South Africa were a couple of percentage points lower than during the Beta wave, which we saw in December 2020, the second wave, or the Alpha wave, which we saw in early 2020, being the first wave in South Africa. So that's an indication of virulence. Keep in mind, there were more infections in wave 3, and so that did still put strain on the healthcare system. It amazes me as I talk to people and interact in society that there are still conspiracy theorists who say COVID-19, it's just a flu, it's a bad flu. What is all this concern about? We're overreacting as a world, as a country. And those people clearly are not mathematical and do not understand the data. Because if you read the data, it's unequivocal that we're going through a tragic and difficult period in history, and that precautions to save lives are absolutely required. So what I'm showing you here is the data from the South African Medical Research Council, which is the most reliable source of data showing, in fact, what the mortality impact, the number of deaths in South Africa is as a result of COVID-19. So across the bottom chart, what you see here is an indication of the 3 COVID waves. And across the top in bubbles, you see the reporting from the South African Medical Research Council of the number of excess deaths, more than expected baseline deaths that have occurred in the country due to natural causes only, unrelated to trauma and traumatic death. For many years, I think it's 17 years now, the Medical Research Council has every year tracked the number of deaths in the country and developed a predictive model which, with high statistical reliability, predicts the number of deaths every year. And if you look year on year, this prediction is very, very accurate. What we've seen in 2020 and 2021 is a marked deviation from the expected number of natural deaths. And as a result, we understand that the real mortality rate in South Africa from COVID-19 is in excess of about 250,000 deaths. So when you listen to the news and you hear that the Department of Health is reporting there have been 90,000 COVID-19 deaths, those are cases where there's been a positive COVID-19 test and where the death reporting and the notification of death by the medical practitioner has captured on the death certificate reason for death COVID-19. It is a gross underestimation and, in fact, a misleading statistic of the real deaths from COVID-19 in our country. Sadly, the real deaths are that 250,000 people have died from COVID-19 in South Africa. And if you look in these yellow bubbles, what you see here is the number of excess deaths as a relative proportion of what was expected during the period relative to the baseline. You can see in wave 1, there were 1.46 more deaths than expected during that period of time. In wave 2, 87% more deaths. And in wave 3, 59% more deaths. What's worrying is that between the waves, the excess death rate is still up. Between wave 2 and wave 3, there was 20% more deaths in the country due to natural causes than one would expect. And that was between wave 2 and wave 3. So we are indeed living through tragic times, and I hope this gives you some clear understanding of the real mortality associated with COVID-19. The 3 waves in South Africa have yielded different insights for us. The first wave and actions, different responses and insights. The first wave was really about us all as employers sending our people home, about the healthcare professionals trying to learn how to treat the disease, about lots of lockdowns and social distancing across the world to try and protect societies. And we saw a rapid acceleration in the number of telemedicine consultations and the use of digital healthcare to engage doctors remotely. What was amazing about that period was that all non-COVID related healthcare admissions to hospitals basically disappeared, quite astoundingly. The second wave was characterized by an understanding of variant formation, the emergence of the first variant that we got to understand, which was the beta variant, but also the ability to treat the disease much better as healthcare professionals. So we saw reducing mortality rate with optimal clinical care and improving outcomes. And then we developed some understanding of long COVID as well. We started treating COVID-19 at home, in people's homes, changed the way care was delivered. And we started really having to get our heads around the long-term effects of COVID-19. The third wave was really a focus on the importance of vaccination, this understanding of another variant, Delta, driving a huge number of infections, and a time during which proof of vaccination has become very important to live a normal life, to travel, if you're in France, to use public transport, to go to a restaurant, a bar, a show, to enter a shopping center if you live in Scandinavia. So proof of vaccination became, and it's just quite interesting to step back and look at the story and the evolution and progression of the disease. So as we look forward and really to come to an end on this section of the presentation, the big question is there going to be a fourth wave? Our actuarial projection is that indeed there is. We think it's inevitable. We think the fourth wave hits South Africa around about mid-December. We think that it'll be the super spreader events of the December holiday season and the mobility and festivity associated with that drives that fourth wave. You can see we have various model projections in different colors for the fourth wave over there. The worst wave, the yellow one, is actually determined by a low vaccination percentage in South Africa. If we are able to vaccinate 60% of the population, we believe we can save directly 25,000 lives in our country. So just absorb that for a second. We need to do something simple as a society and as a country, and that is vaccinate 60% of our people. And if we did that, 25,000 lives. Imagine the impact on nuclear families of those 25,000 lives can be saved. Now, when I graduated as a young doctor, the concept of saving one life, treating one patient and saving one life was astounding to me. Imagine the impact we can have of saving 25,000 lives. I think there's nothing more important for society at the moment. And so we really must ensure that everyone we talk to, we spend all our time convincing people to vaccinate. So we're hoping that this fourth wave is an exit wave. We're optimistic about that. What is an exit wave? Well, what we saw with the 1918 flu pandemic was that they experienced 4 severe waves, and the fourth wave was the last wave that managed to confer sufficient population level immunity to ensure that the flu became endemic, continued to rage on an endemic basis, but without these pandemic or epidemic waves. And that is likely where we'll get to with COVID-19, perhaps not only after the fourth wave, maybe there'll be a fifth. Although our actuarial hope and projection is that immunity through a combination of natural immunity and vaccination is adequate to protect us after that fourth wave. So moving now on to the vaccine progress and the mandates, now that we understand the importance of vaccination. And I'm not going really into the huge detail on this chart about the vaccination. Safe to say that we have administered about 22 million doses across the country. And you can see that by age, there's a reducing number or reducing proportion, this middle chart, a reducing proportion of the population vaccinated. At 60 plus, it's about 62% of the population. And at 18 plus, it's about 20% of the population. And so it is vitally important that we drive continued vaccination. Unfortunately, what we've seen of late is a marked reduction in the vaccination rate. And as this chart shows you in green for South Africa and in blue for Discovery Health, you can see that there's been a 25% reduction in daily vaccinations since the end of August. So there's the end of August there. And you can see a precipitous drop in Discovery's data in the number of vaccinations and in the country's data in the number of those vaccinations. This small uplift that you can see here is when we opened up to new age groups, and that caused a quick spike in the vaccinations, but it seems to have deteriorated down again. This is quite worrying. Demand is tailing off. We're still doing somewhere between 8,000 and 10,000 vaccinations for members per day, but demand is definitely tailing off, and it does not bode well for our country's protection, for our ability to save lives, importantly for our economic recovery, and for the productivity across our society. We need high vaccination levels to get a full economic recovery and return to productivity. So as we stand on the 7th of October, about 36% of the population has had at least a single dose of the vaccine. Our prediction at the current run rate of vaccination, hoping that it doesn't reduce much further, is that we'll get to 52% by the end of the year. Now, you've heard the president mention a target of 70% by year end. Seems clear to us at Discovery that we'll, as a country, will fall well short of that, and we'll reach about 50%. We really need to get beyond the 60% mark if we are to have a material impact on the way for mitigation of severe disease. It is not a linear relationship. It is a curved exponential relationship, or a logarithmic one. And so not getting to that 60% mark means a dramatic increase in the severity of wave 4, both in the number of infections and the number of deaths. And so that is critically important. As you know, at Discovery, we have introduced a mandate for all of our staff to be vaccinated. And this has been quite positively received through most of the stakeholders across Discovery. There is a small proportion of our staff, about 10% on the margin, who are negative about this vaccine mandate and haven't been vaccinated to this point. And we've still got 2 months to go, and we'll have to see where that lands up. And I'm going to talk to you more about mandatory vaccination in a moment. We've done a great deal at Discovery to try and deliver a multi-pronged strategy to drive vaccinations right across the board in employment contexts and for all South Africans. We've built a network of vaccination sites, a digitally enabled vaccine information system and journey. We've really provided a lot of information on vaccination, which I'm about to provide to you today as well, and done a lot to raise awareness nationally. We have vaccinated, or our members have received, more than 2.4 million vaccines as I talk to you now. And we have personally, through our own sites, delivered nearly 900,000 vaccinations at our own sites across multiple locations across the country. The Vaccine Navigator that we launched as a digital tool has received more than 1.5 million logins and hits, and provides not only a vaccine certificate, but an end-to-end journey to support your vaccination, from booking your vaccine to supporting you when you're on site to giving you your certificate at the end of the vaccination. So this has been a very important and meaningful contribution for us. And when we look across the vaccinations that we've administered, you can see that after a slow start over here on the left-hand side, it picked up very rapidly to an average of about 7,500 vaccinations per day during August this year. So that was the August average. We're running at about, on a weekday now, about 8,000 a day. On the weekends, much less. And so the average during October is sadly lower than the 7,500 rand that we saw, 7,500 per day that we saw during August. Now, when we look across the age categories, certainly the elderly have been their vaccine uptake has been better. I think this is because there's a much higher understanding of risk in the elderly population, and probably a lot of mature wisdom in their consideration of this initiative. Just to give you the high level numbers as we sit here today, easy for you to remember, about 60% of all adults in Discovery are vaccinated, 60, of all adults across Discovery Health Medical Scheme are vaccinated, and about 80% of all of the people over 60 are vaccinated. So it's 60 and 80 for all adults and people over the age of 60 years. And that's really what the metrics look like to date. We've seen across the world a swing towards mandates. We've seen some of the world's biggest companies announce mandates, and we've seen many in South Africa also bravely and boldly announce mandatory vaccination, including some really big brands like Sanlam, the hospital groups Mediclinic and Life Healthcare, Curo. And I would say congratulations to these companies who have showed, in my view, bold and courageous leadership to announce these mandates. The primary reason to do it is to protect your employees. The secondary reason to do it is the societal mandate and message around the importance of vaccination. In considering mandatory vaccinations for our own company, and in the advice we've been giving many employer groups, we've met with, I don't want to exaggerate, 30 plus excos of very large JSE listed businesses and large private companies who are all still in the process of considering mandatory vaccination and are announcing it day by day, and you'll hear more in the following week that I'm aware of that will be coming out. The approach is summarized on this slide. Firstly, understand why. And we think there are moral, social, and legal obligations to mandatory vaccination. The primary one is to protect employees, of course. There are specific legal considerations, and my next slide will talk to you about that. From a moral and ethical perspective, we should all feel the responsibility to protect our employees in the workplace. And from a risk and benefit perspective, there's no doubt that because the majority of workers in a workplace are vaccinated, the benefits exceed the risks of marginalizing a small number of people on the margin. Of course, because vaccines are so safe, the actual safety risks of vaccination are very, very high. The safety risks, are very, very low. The safety profile is very, very high. And the benefits, the efficacy is undoubted meaning and power. And so when you put that together, the risk-benefit equation seems obvious. The way that it's implemented is absolutely critical, and there needs to be a very good, well-advised process with industrial relations support to the implementation and communication of this. The legal framework is pretty interesting, and I'm not going to take you through the detail. We don't have time today, but there are various parts of the law shown here in this 5-tier pyramid which relate to vaccination and vaccine mandates, from the Constitution all the way down to the promotion of equity and prevention of unfair discrimination in the workplace. And all of these requirements or pieces of law really have bearing. What's critically important in our view is what's in the center of this chart, which is the Occupational Health and Safety Act. The Occupational Health and Safety Act confers an obligation. It's not a nice to have, it's a mandate, an obligation on employers to protect their employees in the workplace. And it speaks about various risks that employers have to protect employees against. And it includes in those risks biological risks. Guess what? COVID-19 or SARS-CoV-2 is indeed a biological risk, and therefore employers are mandated to protect employees against that biological risk. That law of general application, in fact, in the view of senior counsel and constitutional law experts, exceeds the right of personal choice and overrides the right of personal choice enshrined in the Constitution because of the public good and because this general law of application confers an obligation on employers to vaccinate, or to protect their employees. The legal principles are closely linked to moral and ethical principles, and these need to be balanced through a process of a mutually respectful engagement. One has to take into account the fact that all employees have rights, all employees, vaccinated and unvaccinated. The rights of vaccinated employees can't be overlooked. They should be protected from unvaccinated individuals. Employers and businesses have rights and obligations. The rights, though, are not absolute. Constitutional rights can be limited if they're in the broader public interest, if there are general laws of application that supersede that, and if they are reasonable and justifiable. Employers have this legal and moral obligation, and probably also a completely unequivocal obligation in terms of the Occupational Health and Safety Act to protect employees from hazardous biological obligations. And unfair discrimination can be mitigated through mandatory vaccination, through a proper appeals and exceptions process, and through coming up with means of reasonable accommodation for employees who have a legitimate and rational reason for not being vaccinated. If there is legitimate, rational reason for not being vaccinated, reasonable accommodation can be sought. All of this revolves around vaccine safety and efficacy. And so I want to share with you some of our data out of South Africa. I know you've read lots of the global data, but getting data from people like you and I, members of Discovery Health Medical Scheme, feels different and is very close to home. So if we start on the right-hand side of this chart, what these 4 diagrams show you is a measurement of risk reduction, in a vaccinated population relative to an unvaccinated population, insofar as infection, admission to hospital, admission to ICU, and death are concerned. I've got hiccups, I apologize. And what you can see starting on the right-hand side is that vaccination confers about a 93% reduction in mortality risk, a 70 to 90% reduction in ICU admission risk, a 65 to 90% reduction in hospital admission risk, and a 50 to 80% reduction in infection risk relative to unvaccinated individuals. This is in a post-Delta world. So this takes into account Delta. In a pre-Delta world, if you looked at this with the Beta variant, the reduction of infections was actually much higher. But in a post-Delta world, the reduction of infections is lower. This mortality risk reduction is so meaningful that if you compare it to the flu on the left-hand side of this chart, your chances of dying from COVID-19 post-vaccination in a fully vaccinated individual are lower than your chances of dying from the flu. That is what happens to mortality risk post-vaccination for COVID-19. Whereas pre-vaccination for COVID-19, you have an 8 to 10 times greater chance of dying from COVID than you do from the flu. And the reason this comparison to the flu is useful is because naively some uninformed people or misinformed people talk about COVID-19 as just a bad flu, which is hard to understand. I thought that this infographic approach of representing vaccinated versus unvaccinated complications of COVID-19 is a very helpful way of looking at it. If you start on the right-hand side and you look here for our data, this is Discovery Health data as at the 21st of October, 2021. So a couple of days ago. If you look at the total people on ventilators, there are 3 fully vaccinated for every 28 not fully vaccinated. Sorry, let me start again. There are 31 that are either vaccinated or partially vaccinated relative to the balance of all of the people who are being ventilated. So 90% of active ventilation admissions are for people who are not fully vaccinated. In ICU admissions, 83% are for people who are not fully vaccinated. And for admissions, 78% are for people who are not fully vaccinated. And when you look at the humans in the picture, it really, it boggles the mind why somebody wouldn't be vaccinated when you can see how the unvaccinated are really the ones that are being admitted to hospital and are requiring care. This is very new data that we're going to release formally in a press release to South Africa next week. And what it shows you is after receiving dose 1 of the Pfizer vaccination and after receiving dose 2 of the vaccination, what the vaccine efficacy is at preventing severe illness and death from COVID-19. We've done this research with Israeli scientific methodologists and researchers together with the South African Medical Research Council on our own data. And what it shows you is that at 42 days plus after receiving the second dose of Pfizer in South Africa, there is a 94% risk reduction. In other words, COVID-19 is 94 to 95% effective at reducing your risk of complications of COVID-19. And you can see how this risk reduction improves over time relative to days after the first dose and days after the second dose. This is brand new data that we'll be releasing formally to the market and to the media next week. What's important is when you extend that to about 100 days after the second dose. So that would be about 150 days roughly after the first dose. You can see that there is no waning of effectiveness. The vaccine remains more than 90% effective, in this case, the Pfizer vaccine, at protecting you against the complications of COVID-19. I hear often that natural immunity is as good as vaccination, and I should tell you that in our own data, it is not equally as good. Vaccination, together with natural immunity, actually confers even lower odds of admission and fatality relative to people who haven't had a prior infection. So for those that have had a prior infection, if you look at the days since their documented infection, and you look at the number of people required to be admitted to hospital with a new COVID-19 infection, you can see the unvaccinated in blue exceed the fully vaccinated in green quite dramatically. So vaccines, even if you've had a prior infection, reduce your risk of admission to hospital dramatically. And this is because natural immunity wanes. And the same is true for deaths. If you're vaccinated and you've had a prior COVID-19 infection, you can see your risk of death is virtually zero post-vaccination, whereas if you're unvaccinated, you still have a risk of death following COVID-19 prior infection. So, to answer your question directly, a common question that gets answered, if you've had a COVID-19 infection, there is still a great advantage of being vaccinated. What's quite interesting is when you look by age group or look by the number of chronic illnesses that people are living with, you'll remember my previous charts showed this precipitous increase in risk at older age and for people living with a higher number of chronic diseases. What happens to those same charts when you're vaccinated? Well, what you can see is in the chart here related to age, you can see there is an increasing of risk relating to age, but it's not nearly as steep as those previous charts I showed you in the unvaccinated cohort. So actually what you're seeing is that people over the age of 80 are still well protected by vaccines, although they do have a higher risk than younger people of severe complications of COVID-19. And the same is true for people living with 3 or more chronic conditions. So I hope it's clear to you that whether you've had a prior natural infection and are living with natural immunity, whether you're at older age or whether you're living with chronic illness, vaccines still provide good protection right across the board. The other thing that's highly relevant in a workplace environment is I often get asked by young people to say, why should I get vaccinated? I'm young, I'm healthy, I've got low risk of COVID-19 complications. And if the people around me are vaccinated, so what? Well, the answer is in this chart. The answer is that as a vaccinated person, you have a 50 to 78% reduction in likelihood of spreading the virus to people that are in close contact to you. In these studies out of Israel and the UK, it was done on a household basis, but it could well be that you're sitting in the same office as those people. So I think equally relevant in our view to a workplace environment. A 50 to 78% reduction in the chance of spreading the disease. The reasons for that are primarily that firstly, you have a lower chance of contracting COVID-19, as you see in the data on the left here from Australia and from America. And secondly, as you see in the data in the center here, you have a much lower viral load. In other words, the amount of virus in your body after a COVID-19 infection is much lower if you're vaccinated than relative to being unvaccinated. Importantly, what we see is we've developed a resilience index through Vitality, which shows that highly engaged Vitality members have a much lower risk of mortality from COVID-19. Even if you've got one comorbidity, even if you're over the age of 60, and certainly if you're looking at all clients, you have a marked reduction, an 81% reduction at diamond status, or a reduction in risk of mortality as a result of COVID-19. And this is simply as a result of physical activity and low body mass index. Those are the two factors that seem to confer this correlation in vitality status to lower mortality risk adjustment. In fact, when you plotted on the death curves or the mortality curves that the actuaries use to calculate mortality risk, you can see that an average 75-year-old who is vaccinated has the same risk of dying from COVID-19 as a 40-year-old who has not been vaccinated. So that's risk reduction through vaccine. And if you look from a vitality perspective, you can see that vitality, that high vitality engagement, regardless of age and comorbidities, confers a marked bending of the QX curve or lowering of the mortality risk curve at a population level. What we're seeing globally is very high vaccine safety, a very low proportion of adverse effects. And this is data that I'm showing you from Australia, where they've tracked very carefully the administration of 27 million vaccinations, including 15 million Pfizer doses that they've given. In the Pfizer population in Australia, they have not had a single death, and they've only had 7 what we would call severe complications, all of which were myocarditis, which is an inflammation of the heart muscle, and all of which recovered on their own quite satisfactorily. The AstraZeneca population looks slightly worse from a side effects profile. There's been 1 death out of 11 million doses administered, 1 death from 11 million doses, and a couple of severe illnesses, fortunately, all of which are treatable. So in this cohort from Australia, we can conclude that in general, vaccination against COVID-19 is extremely safe. The side effects that are experienced are in the majority mild and recover within 24 to 48 hours. The number of severe illnesses is very rare. They're more common with AstraZeneca than they are with Pfizer, but in any event, they remain extremely rare. How does this look in South Africa? And here's an indication of our own data in South Africa. Your chances of a severe complication of COVID-19 are materially higher than your chances of a severe complication of vaccination. What you see in orange are the complications plotted on this chart, and you can see that pulmonary embolism and acute kidney injury are common complications of COVID-19 infections. I think what's important for your purposes is all the complications of vaccination shown here for Pfizer dose 1, Pfizer dose 2, and J&J are virtually invisible on this chart. And this is our data for members like you and me here in South Africa. Importantly, what we're seeing in pregnancy is a large number of complications from COVID-19. And we're seeing that unvaccinated complications in pregnancy are actually quite common, unfortunately, relative to the vaccinated cohort where they still occur, but at a much lower proportion. And so please, if you're over 14 weeks of pregnancy, it's very important that you vaccinate. Coming to the end of the vaccination story on this chart, and then I'm going to pause, just to say that at an economic level, it is also equally important to vaccinate for our country. What the chart on the left is showing you is work done by the World Health Organization to calculate a return on investment. Sorry, it wasn't the WHO, it was the World Economic Forum, to calculate a return on investment for vaccination at a global level. What they're saying here simply is that to vaccinate the world will cost the world $38 billion by 2025, but by doing so will save the world economies about $460 billion. It's a 12 times return on investment. If you offered me a return on my money of 12 times, I'd invest tomorrow in whatever that investment is. I'd hesitate and say it sounds too good to be true, ladies and gentlemen. Well, here for vaccination on a global level, there is a 12 times return on investment. Our Discovery Health Policy Unit, working with Business for South Africa, has done a similar cost-benefit calculation for South Africa, and we have estimated that there is a GDP impact, favorable impact of somewhere between 11 to 20 times money, 11 to 20 times return on investment by vaccinating South Africa for the South African gross domestic product. I've run out of time. I've reached my 45-minute mark that I was given. I've enjoyed this presentation so much that I've gone a bit slower than planned. But so what I'm going to do there is stop my share, pause now, hand back to David and Chris, and just wish you all a very, very good continuation of the conference. I know today is the last day. Just to thank EBnet really for the opportunity and for this great conference. And I'm happy to take a few questions and answers as they arise. So I'm going to cancel my screen share now.
Thank you very much, Ryan. It was extremely insightful. And I must say, I applaud Discovery at the research and what they've actually done in the marketplace to try and overcome the pandemic. I think it's unbelievable what they have done as a business, and to yourself. Really, listening to your talk now, I mean, it is quite scary and thought-provoking to think what we've actually been through. It's daunting, to be quite honest with you. We as a small employer of about 100 people are facing the same issues that many industries are, many businesses, and having made it mandatory, they have until the end of the year in our business to actually get vaccinated, or we're going to be having another discussion with staff, which is very interesting. And we don't have the 60% that you have in terms of vaccinated people. We're sitting at around about 35% vaccinated people. And for whatever reason, there's still a huge amount of people out there who just don't want to get vaccinated for whatever a myriad of really poor reasons. But be that as it may, you know, I kind of all we can do is go around and hopefully get more and more people and convince them of, you know, the factors that are positive in terms of why they should be vaccinated. One of the things that you've shared with us, and I'd like to just ask you a quick question, is that while there's we spoke about efficacy, a lot of people are starting to talk about booster jabs going into the future, and you spoke about 150 days that your vaccine has efficacy. I mean, is it 150 days? Is it longer? What are your thoughts in terms of booster jabs for those who have been vaccinated twice already?
A very important question, David. And just firstly to say congrats to you for adopting a mandate as an employer. It's a courageous and bold step to take. Our employees now, we've just crossed the 80% mark of vaccination in our employee base. You know, you must remember that we employ about 3,000 call center personnel who are in the lower income groups. And so we're delighted that we've got to 80%. And just to tell you what I'm doing is every day I reach out to some of the unvaccinated people in the team and I have personal conversations with them. Many of them are just frightened and are misunderstanding some of the information on the internet. And I think education and information is important. The booster question is a critical one. There is clear evidence emerging first from Israel, but now also from the US and the UK and other parts of the world, which shows that the antibody levels, the antibody titers, the amount of antibody in your blood, starts reducing from about 6 months after vaccination and gets to a point at about 9 to 12 months after vaccination where it seems necessary to reboost the immunity. This is unfortunate because it means that we need to work through the population and boost all of their immunity. It's expensive and it's cumbersome, and we have to go through another phase of convincing people to be vaccinated. Aside from that logistical complexity and the work you have to do with people, there's no downside to it other than the cost, of course, because it has almost no morbidity associated with it. But it does seem inevitable that as populations will have to boost their immunity, certainly with the Pfizer vaccine. The Johnson & Johnson vaccine is showing something interesting and quite different. In the first instance, it probably should have been a double dose regime because the immunity is best after 2 doses. But in fact, the immunity from Johnson & Johnson doesn't seem to wane. It seems that the cellular immunity actually apparently and potentially strengthens over time. And the durability of the immunity with the Johnson & Johnson vaccine seems slightly better than with the mRNA vaccines, like the Pfizer vaccine. I think it's inevitable that here in South Africa, we'll need boosters. I'll be the first in line for a booster when they become available. The Medical Advisory Committee and the South African Health Products Authority is working through the data. And I think because we're slightly behind the rest of the world in terms of the timing of our rollout, I think we'll follow the rest of the world shortly with boosters. Already, our Department of Health has agreed to boost people living with immune compromise. And so if you're one of those people, you can get a letter from your doctor and go and have a booster today. And I would suggest you do so if you live with any immune disorder that means you're immunocompromised. I think for other people like you and I, David, of slightly more advanced age than others, although I still consider myself young, I think we're likely to be boosted quite soon.
Okay, thanks. That's very interesting. And certainly I'll be one of the first to line up. I suppose from 9 to 12 months, I'm still kind of quite young. I'm only about five months or so since my second jab. So I've got a little bit of time to go. What was a bit concerning was the fourth wave. And what I'm starting to see in some of the my reading is that the overseas experience has been that, especially in Europe now, as it's starting to get colder, and albeit that they are vaccinated far higher than what we are in South Africa, there seems to be a vast increase in the number of COVID cases appearing again. What are your views on that? I mean, is that the kind of precursor to the fourth wave in South Africa? Has it got something to do with weather conditions?
Yeah, excellent question, David. We have a health insurance business in the United Kingdom called Vitality Health. It's the third largest health insurer in the United Kingdom. And so we have a first-hand experience of the market and a lot of access to data there. And the story is as follows. They are certainly going through a fourth wave in the United Kingdom with a rapid increase in the number of infections. They were pretty, on the one hand, reckless, perhaps on the other hand, courageous with their approach towards social distancing, where they dropped all mask-wearing mandates and all social distancing requirements very early. And then they had events like Wimbledon and the Euro soccer event. The Premier League, as we all know, is back in full force, and we're seeing packed stadiums and crowds as we are at the rugby stadiums. This is without a doubt, these are super spreader events that are driving infections. As you saw from my data, post-Delta, you only have about 50% protection against an infection when you're vaccinated. So you're 50% less likely to get an infection than a vaccinated person, but you still have a big chance of an infection. And so the majority of the infections are in the unvaccinated. There are infections in the vaccinated. What's important about the UK experience and so reassuring is there's been a decoupling between the number of infections and the number of hospital admissions and deaths. And actually, when you look at their third wave versus their fourth wave, in their third wave, they had deaths and admissions associated with that infection wave. In the fourth wave so far, we've seen an increase in the deaths and the admissions to hospital, but not nearly to the same extent as when they were unvaccinated. And when you go into the hospitals and you go patient to patient in the UK, they're almost all unvaccinated people that are requiring admission. So the vaccines are seen to work. It's the reason why the UK hasn't reimposed severe restrictions, because the vaccinated people aren't dying, though we have to watch and wait and see what happens. I think they've been particularly courageous or reckless, whichever way you want to look at it, in respect of their precautions. I personally think they've let the pendulum swing too far back, and that they should find a happy medium somewhere around social distancing and mask wearing.
Thank you very much, Ryan. Thank you for your time and sharing your wonderful insights and those of Discovery. And, congratulations on what you've done in terms of the healthcare industry and really supporting the pandemic and making a difference. And I think that is what I want to leave you with. Thank you very much.
David, thank you. And to Chris, thank you for the opportunity. And very good to be partnering with you and sharing space with you as always. All the best.
Thank you very much, Ryan.